one of the ways that we have been making sure that we are spending our funding in North Carolina towards the highest need and highest priorities is really putting in place processes that enable us to fund based on social vulnerability index. And so we are looking at how we fund our counties that might have a greater need for it, get more funding, and obviously we want to provide some baseline funding per capita for every county as well. And so using that method to really prioritize where the need is greatest. And we're also doing that in how we consider bringing on board vendors to do services. So, for example, we all know that we've been using a lot of this funding to support COVID-19 testing and vaccine-related services. So we are really prioritizing the use of those vendors and those state resources in high-priority communities to really focus on historically marginalized populations. And again, those places that we know have higher social vulnerability index, so we can make sure we're targeting those resources to those that need it the most. One of those things is certainly hiring. We know we've been fortunate to receive lots of funds that we have been able to hire additional staff at the department and the Division of Public Health. And one of the ways that we have expedited that is, in the past, we had to wait to have that money in hand before we could start the hiring process. So we worked with our leadership and additional folks across the department to make sure that we were able to start creating positions, even though we didn't have the funding in hand, start creating positions in anticipation of what we would need, get those positions through our review and approval chain, and even get them to post before the funding had come in. So that really helped cut down on the process, particularly for HR and for getting some of the staffing on board or ready to be onboarded as soon as that money was in hand. So that's one of the things we used. The other piece that we've been using is really just making sure that we are talking with our partners. Oftentimes we hear about funding coming in through ASTHO and some of our, other partners. And so as soon as we hear about those things, making sure that we are having those conversations with our communities, with other divisions across our Department of Health and Human Services that is touched by that grant, and starting to formulate some of those plans. We might not know the specifics of the actual funding that's released, but usually you know enough to start formulating those plans and making those partnerships come together. And that always helps as well as we anticipate funding coming down, and oftentimes these days coming down with shorter timeframes to respond.
Obviously, with our state of emergency and executive order, we've got some additional capacity to contract and flexibility within our own procurement policies. That being said, to echo what Dr. Consagra talked about with use of our health departments and partnering with known entities, we've done a lot of partnering with our local health departments and districts, as well as nonprofits that we've worked with proven track records to get the funding out. Additionally, we've worked to create pools of pre-qualified vendors. So when we needed to do COVID testing or COVID vaccine, we created a request for proposal process where we would pre-qualify vendors that could meet the state's requirements. And then we could issue a specific scope of work to those vendors and then work in a more expedited fashion, as opposed to going out and procuring from start to finish every single need that we had. So we're trying to, again, leverage key existing partnerships to give our state the most impact and with the least amount of risk. We first look at our funding source. So in some cases that may be a federal grant, and specifically with these COVID supplements that have been coming down, the CDC has been really prescriptive around the metrics that the state needs to report back. So we pass those same metrics down to all of our sub-grantees. With regard to our vendors, we also have very specific deliverables that we expect them to deliver on. And both sets of agreements have contract administrators and monitors in place all of our agreements are written with those measures in the contract, and we've got reporting that are always due back to us from either our subgrantees or our vendors in order to support the work that they're doing and that we're paying for. So that monitoring process is ongoing on a monthly or quarterly cadence. In some cases, with brand new initiatives, and like that comes to mind, a lot of states were using incentives for folks to get vaccinated, and North Carolina certainly did do that. That was a brand new incentive for us that didn't have any sort of scientific data around it. So we contracted with one of our universities to actually conduct an evaluation of that program in order to help us measure its success. Additionally, we continue to sort of refine our processes so we can reduce the burden on our subrecipients, and in particular, our local health departments, who are really, bearing the brunt of the pandemic at the local level. So what can we do to streamline their reporting process? And we've leveraged some technology called Smartsheet to really give a baseline for their reporting and a consistent way that they report their metrics back to us on a regular basis. Right now, we do have a lot of flexibility. I think we're looking ahead of when to that endemic state of where the emergency declaration is over. And so we're trying to leverage that pooled vendor idea. So right now, the state is in the middle of a process where we've released additional services out for requests for proposals, again, to pre-qualify groups of vendors that not just might provide sort of the standard goods and services like we've seen in the pandemic, like PPE or the COVID testing or COVID vaccine implementation, but also the sort of services that we've become really reliant upon in terms of gathering our data and things like that. So creating that pool of vendors forward looking, I think, is really going to help. That has not been implemented yet, but we're working toward it. We've also identified additional goods and services that are not on our state term contract and probably should be. So where our department is trying to pre-qualify vendors for us, we are also identifying things that haven't really come up in a major way before that impact all of our agencies at the state level. And so we're giving recommendations to our statewide procurement offices what we think really need to be on state term contract to make procurement easier. And then finally, I would say information technology procurement is always sort of the trickiest. And we haven't figured out a solution for that, because while our procurement flexibilities might be there, especially during the state of emergency, what we don't have flexibility around are the security requirements that our state deems absolutely critical. And so that is something that I feel like we need to continue to work in partnership with our division IT, our department IT, and our state IT in terms of developing a minimum threshold of what we need to be secure, and get the work done that we absolutely need in a critical crisis like a COVID pandemic.
Well, I think the biggest thing is partnering with, your finance teams, your procurement teams, your HR teams, making sure that they know from the beginning what you're intending to do with the funds that are coming in, and setting up those governance teams early on so that you can plan collectively together and set yourself up for success as you receive the funding and go on to implement activities. And then, I'll also mention that one of the strategies we've used is, I know oftentimes in the beginning when funding comes out, you get a lot of different community partners that are coming at you and wanting to know how they can, work with you on the proposal and receive some of the funding as well. And so we've also used a mechanism where we create a menu of actions that local partners can do that fall within the scope of the grant and issue an RFA. And so that creates a really level playing field, gives everybody the opportunity to apply for the funds if they can do one or more of those activities in that menu of action. And that's worked really well for us too, to get, increase the number of partners and again, create that playing field from the beginning.